Most people that we see have had a problem with their weight for some time, and often we see people that have been on a number of diets over the years, and they can usually quote all number of different diets and describe how much weight they lost with this and how much with that. And this idea of yo-yo dieting, where someone gains weight and then loses weight, is a really common feature. By the time we see them though, people have often been thinking about doing something more effective for some time. And often people have talked to others that may have had weight loss surgery, friends or family or workmates, and they've often been looking on the internet and maybe watching media on TV. And they've done a lot of thinking about this. So often people have spent some time considering whether weight loss surgery might be appropriate for them before they come and see us. There's a few aspects to that. The first is that you need to have an objective issue with your weight. So you need to have moderately significant obesity, whether you measure that by kilos or whether you measure that by body mass index, which is a number one gets from looking at someone's height and weight. Another aspect to take into account is whether that excess weight you have, your obesity, might be associated with problems of some sort. Now that might be a health problem like diabetes or high blood pressure, or it might be a quality of life issue, such as inability to do things you like to do. And I think it's the combination of those two factors that are important. There are some health conditions that do make bariatric or weight loss surgery a more serious proposition, and we like to identify that if we can. Another factor that comes to bear in this is whether we're seeing people in the public or the private sector. The number of people that would benefit from weight loss surgery is far greater than the public sector can pay to have that surgery. So in the private sector, if you have compelling reasons for bariatric surgery and bring your own resource, the access to weight loss surgery is easier than in the public system where there's simply not enough resource to go around. Although most people have been thinking about this for some time preparing, not everyone has, and we can't assume that people have done that amount of preparation. So we see our job as making sure that this is the right person to be considering surgery, that they've got enough to gain. We need to make sure that they are prepared for what surgery involves, both the operation itself, but what living with a gastric bypass or a sleeve gastrectomy means for their eating and everything else afterwards. So we work as part of a team. It's not just the surgeon that you see. We also have dietitians that we work with very closely. We have psychologists in the team. And the idea is that with that team we can prepare people to do well with their operation. In terms of what people have to do before surgery, we know that surgery works best when it's combined with lifestyle change. And what we mean by that is a healthy diet and adequate regular exercise. So we do encourage people to make those changes, and we encourage that to happen before surgery because that's an appropriate time to start.